going to be getting some PRP injections in my neck. That stands for platelet-rich plasma. It's a type of regenerative medicine, and if you guys have been around for a while, you might remember that I had these PRP injections in my neck below my fusion last year, probably about a year ago now. I actually had good success with those injections, and so we are going to do another round. I'm excited to see how much it helps this time, and I'm hopeful that it will help even more. So I have a fusion from the base of my skull to C2 in my neck, so there's no point in doing any type of regenerative medicine injections in areas that are already fused. And so these injections are for instability that is below my fusion, so it's everywhere below C2 down to like the top of my thoracic spine. I'm sure some of you that have craniocervical instability may have heard of a special procedure for craniocervical instability that is done by Regenerative, and it's a stem cell procedure, and they only do this procedure in Colorado, and that procedure for me really wouldn't be an option because I'm already fused. That's why we don't need to go out to Regenerative in Colorado to get this done. It's really sunny outside, so I'm going to put my sunglasses back on.
My sunglasses back on?
Oh, these ones are mine.
Oh.
For once. If you guys aren't familiar with regenerative medicine, basically the idea is that they inject these platelets into the soft tissue and the ligaments of, you know, an injury, or in my case, unstable joint areas. So they create kind of these small injuries and promote more healing. And so they create that inflammatory response, and then they're hoping for promoted and better healing within that area. And so unfortunately this is something that is not yet covered by insurance, so it's fairly expensive. If you guys have heard of prolotherapy is kind of the entry-level, cheapest type of regenerative medicine, and then next comes PRP, and then next comes stem cell. And I tried prolotherapy a couple of times. Unfortunately I did not have any success with it, but I did have really good success with the PRP, and at that point my neck was so bad that I really could barely tolerate to be out of my neck brace at all, and we were really thinking that I was going to need further fusion below the fusion that I already had done, and I haven't needed it since I got PRP. It really has helped, and we're hoping to keep putting that off, and hopefully I'll never have to have any more fusions. We're really thankful for it, and it's been worth it for me. I know everybody is different, and it may not work for you, but I'm glad that we tried it, because that was just another big surgery that was avoided. So anyways, we are going in to get my blood drawn, and then they're gonna like use their little machine to spin the blood or whatever, and then we'll come back again later this afternoon to get the actual injections and give you guys an update on how it goes afterwards. Catch you later. We got back from the blood draw and it went fine. She actually got it on the first try, so that's always a big success when that happens. And this place actually does the blood draws at a separate time than when you have the injections, whereas like the last place I went to, they did everything all at the same time, and we just waited for them to get the blood and platelets ready to inject. It probably just depends on where you go. It is quite a bit of blood, so I was feeling lightheaded by the end, and I'm still feeling a bit more lightheaded than usual, but I'm fine. So we just have the injections coming up in a few hours, and they typically will offer you like Valium or I don't know, laughing gas or whatever, something to help you relax or help with the pain. I'm not gonna go for those. I just don't like taking extra medication when I don't need to, and I didn't do it last time, so I think I'll be okay. It definitely was probably the most painful injections that I've had, and there's a lot of them, but I just always like to say, you know, it'll be over soon, and it is what it is. So it's all good and it's worth it. So yeah, I'll see if I can like take a picture of what the blood vials look like when we're there, or maybe the screen where they show the x-ray guidance and them injecting the needles. We'll see if Jake can get something from when we're there, but if not, I'll just catch up with you afterwards. Because the procedure was done with x-ray guidance, we all had to wear the protection, and they let Jake come in there with me, and here we are all ready to go. They have you lay face down while they do the injections, and you can actually see the metal in my head there on the x-ray, which is cool. So it has now been 4 or 5 days since I had my PRP procedure. Afterwards, my neck almost immediately felt more stable, just like really stiff. For me, both times my neck has been like really, really sore. Kind of like a giant bruise, and when you move like anything in your body, you kind of feel it in your neck. But that's actually good. That's to be expected, and something that you want with PRP is to be extra sore, because that shows that like the procedure worked in like creating that injury in the soft tissue, and hopefully your body will heal more because of that. Unfortunately, I ended up having a reaction to the procedure that I didn't last time. We don't know if this is because I've been treating for Lyme disease or what, but my Lyme doctor did say that sometimes patients do have a flare in symptoms with PRP procedures because it kind of creates an immune response, and anything that does that can flare up chronic infections like Lyme. And so I had a pretty rough few days after the procedure, and I don't want to scare anyone that's going to be having PRP, because it isn't common for people to have these reactions, but I just want to be real and share with you guys that I did have a pretty bad reaction. We came close to going to the ER that night, but thankfully things have gotten better over the past few days, and I think I'm over the worst of it, so that's all good. And I think hopefully it'll be worth it in the end, but it really did end up being a lot rougher than the first time I had the procedure done. So I guess I should clarify that the reaction that I had wasn't related to symptoms with my neck. Of course, I had the extra stiffness and the different type of pain caused by the procedure, but that is good. That's to be expected. The symptoms that I had flare up were like dizziness, lying down, extreme fatigue, confusion, just a lot of symptoms that I really don't like. Things are going better now, and I just think it's cool that I can feel like a more stability in my neck after the procedure. And by that I basically just mean like just sitting here without my neck brace on, it feels easier to hold my head up. And those that have cervical instability or craniocervical instability probably know what I'm talking about when I say that. Yeah, that was my experience with PRP for the second time around. If you're having PRP, best of luck. I did want to mention that they often also offer medications that can help anxiety or pain during the procedure. The pain during the procedure is often compared to like a bee sting, and they do have to do lots of different spots, probably, I don't know, 15 or 20, so it's a lot. It does hurt, but you'll do great. You got this. I'd love to hear how PRP or stem cell or prolotherapy has gone for you down in the comments below, and be sure to subscribe, and I will look forward to seeing you guys next time. Bye!